is about cultural uniqueness, sensitivity, and competence. So when we look at culture, culture is a way of life, right? It's learned behavior. Um, it is the ever-changing knowledge, ideas, thoughts, beliefs, values, communication, actions, attitudes, traditions, customs, and even objects that a group of people possess, and the way they have of doing things. Okay. It also is going to include the things, like our standards of behavior, our set of rules. When we look at customs, hold on. When we look at customs, those are the generally accepted ways of doing things that are common to people who share the same culture, right? So, when we look at cultural competence or culture itself, right? Members of a certain culture have certain thoughts and beliefs and ways of doing things and customs. And a lot of us belong to different cultures, right? So we may identify as like our birth culture, right? How we were raised and how we grow, but there's also things like school culture, right? And being a student, um, being part of a church, being part of a community that may be a little bit more diverse, right? So many will identify as, within different cultures. So cultural skills for effective nursing. So we look, one of the biggest things about culture is learned behavior, right? How we, the culture that we grow up in, right? We learn certain behaviors that are, part of that culture. And it's, a learned behavior. It is also passed from generation to generation, right? So you learn from your parents, they learn from their grandparents, so on and so forth. And then, of course, we are going to bring this culture to our children, right? And pass it down. So cultural competence is the continuous attempt by nursing or nurses, LPNs, to gain the knowledge and skills that allow them to effectively provide care for clients of different cultures. So within that too, we have what's called cultural sensitivity, and that's an awareness of different cultures, right? Our culture isn't the only culture, right? Your individual culture, there's many different cultures and different beliefs that are out there. Um, and that term enculturation is just learning your culture, right? The way your group does things. And then socialization is a person of one culture learns how to function in a larger culture. And that's what I was saying is even though we were born into a specific culture, right, we're part of other cultures, right? You're a student, now then you're going to be a nurse, right? You're going to start practicing out in nursing world, right? And that's another culture. So, it's really that's what socialization is about, right? It's even when, kids go to school, right? They grow up within the culture of their household and then they go to school, right? And that's a whole totally different culture. They're meeting people from other areas, other races, other religions, and they learn how to interact. So universality, everybody, all of us, we all have the same basic daily needs, right? Doesn't matter how old we are, if we're male or female, how much money we have, what our lifestyle is, what our religion, where we were born, what our culture is. We all have the same basic needs, right? And those are the Maslow's hierarchy of needs. And so, Shahana, are you driving?
I just parked.
I'm
I'm
sorry.
sorry. I said I just parked in front of my house.
If you're driving, can you just go ahead and log off and log back in when you get home?
Yeah, I just parked. Like literally.
So when we think of Maslow, Maslow has his hierarchy of needs, right? Those lower level of needs are going to be the universal needs. And so those are things like rest, nutrition, hydration. Everybody has heard of Maslow's hierarchy of needs, right? No matter who you are, we all have those same like basic level of needs. And those are the main needs that we are going to address when we are caring for clients, right? That is, often sometimes even the basis of how we develop our plan of care. So when we look at developing cultural competence, right, how you think is often influenced by your culture, right? So when we look at culture, and we talked about communication last week, right? So we talked about some of the difference with, culture and how different people communicate. But what are some other think when we in regards, let's just say with healthcare, what are some cultural beliefs about healthcare that we would, come across with working with members of other cultures?
Some cultures believe in the person giving care being of the same gender.
Absolutely. So some people believe that, right, that the person giving care needs to be the same gender. That's a really good point, right? So we have to be mindful of that.
Some cultures,
What-
I think Amish, they don't allow you to go to the hospital unless you speak to like the I forgot what it's called, but like the head person.
Okay.
Mhm.
Okay, so there may be some I don't know what they're called either in the Amish can't even say it. Do they have I don't know. That's a really good question. I'm gonna have to look that up. But yeah, so that they don't generally have a lot of interaction, right, with people outside of their community. When regarding healthcare, what are some other things that may be affected?
Some religions might not want to use, I mean, cultures might not want to use like medications or like with Jehovah's Witnesses, how they don't do the blood transfusion. There's different things when it comes to saving their life or whatever.
Right. So you're absolutely correct. So there may be some things that they won't accept, some care that they don't want. They may not believe in Western medicine. They may not want to take right medications that are prescribed, right? They may want to lean towards more of like the holistic type medications. Values may differ as well. So we look at, and of course, it's going to be hard. You can't always determine, you're not going to know everything about every culture, right? You're going to get some understanding of different cultures and those that you come in contact with. But like when we look at values, there are some cultures and things that believe that illness is like a punishment, right, for a wrongdoing, something that they have done wrong in their past, right? So they kind of take that almost like a punishment, right, because they got sick. So it's really important that we always look at the uniqueness of each of the clients that we are dealing with. And like I said, you're gonna know maybe a little bit about each culture. And the best way to continue to learn, of course, you can do research, but is to always ask because even every member of that culture may be different, right? They may not follow all of the practices. And you mentioned Jehovah Witnesses. Jehovah Witnesses, right? They don't generally accept blood transfusions, okay?
Mhm.
But one thing that I will say, and is something that has come up with me personally in my practice, is I did have a Jehovah Witness once who needed a blood transfusion because of severely low hemoglobin. I don't remember the exact number. And the doctor had recommended him getting a blood transfusion. Um, and others just assumed because he was a Jehovah Witness that he was not going to accept it. But when he was asked, hey, look, these are your options. You can have get a blood transfusion. There obviously is some other options, and he chose to have the blood transfusion. Okay, so always look at the uniqueness of your clients. Just because they fall into a specific culture does not necessarily mean that they are going to follow everything within that culture. Other some dangerous thinking. What is stereotyping? We look at stereotyping. What is stereotyping? Without
Like
looking at
just
the time.
automatically, I was just automatically assuming that somebody is a certain way because of how they look or their culture, like you just were saying.
Exactly, right? It's a generalization. So you kind of group everybody, in a specific group together, regardless of any individualization. Cultural bias is another one. And so this is a mental learning that is never proved or questioned by the individual. So the worth of everything is just dependent on their worldview of the cultural group. Okay. So it's kind of just saying that this is kind of just the way it is. It's not questioned, it's not proven. This is just how we are going to continue to do things. Other dangers too, we have ethnocentrism, and this is a little bit different. This is saying like my way or my culture or my group's way is the best way, right? That, no matter what other culture it is, whatever it is, my way is better than everybody else's, right? So it's kind of like putting yourself up and above. Prejudice is an intolerance of another cultural group. And then, of course, discrimination, which is often the result of prejudice, is withholding rights and privileges from those of another group. So, one of the biggest things that, as future nurses, those working in healthcare, we have to be really careful. We don't want to make any, we don't, want to make any prejudgments. We also need to be very open-minded and non-judgmental, right? And non-judgmental, there's things like just accepting the way people are and that they are doing things because they want to do them. That is their personal choice. And it's always about providing high quality care for our clients regardless. And so one thing that we do need to do is always be aware of your own attitudes, your own beliefs, your own values, and any hidden biases that you may have that may affect your ability to care for your clients. Um, Everybody has biases, okay? We may try not to have biases, but we all have biases. And so understanding those and just knowing that they exist within yourself, right? That's one of the key things that we can do. But again, as future nurses, right, our job is to make sure that we are providing quality, safe, effective care for all of our clients, regardless of who they are, where they're from, and all of those things. So we'll look at cultural diversity. And again, that's one of the biggest things with cultural diversity is really looking at yourself, knowing your own cultural beliefs, your own cultural values, and your own worldview and how your worldview influences you on how you think and how you act. And there's somebody said earlier, like when we were talking, when I mentioned about what are some of the different things like within culture that could affect healthcare, right? And having like the same sex caregivers, those kinds of things. But we know culture can affect everything about us, right? It can affect our communication. It could affect it's our language, it's our values, it's our roles, the roles of the male, the roles of the female. Concepts of time are different among different cultures. Family structures, family dynamics. Um, so there's a lot that goes into culture. And so look at family structure. Okay. So the family unit, that's the basic unit of society, right? And look from culture to culture. There's a variety of different types of families out there, right? Some cultures have multi-generational people living in one house, right? So you may have great grandparents and or grandparents and kids and grandkids all living underneath the same house. Family also is whatever somebody says it is, right? So a family can be a group of people that is completely unrelated by blood, right? That live together as, a group. So really have to look at that and how that plays. Um, Political views obviously are going to change as well. Different religions, ethnic groups, those are all part of the social organization. Space. We talked a little bit about space last night or last week when we were talking about communication, right? Space is, different for each person. Some people like a very, significant amount, like that 6 foot space in between each other. Others like to be much closer. Um, but that is often affected by the culture and how you grew up. Um, your biological variations, genetic tendencies, right? So body build, eye color, hair color, nutritional variations, right? Even the incidence of specific diseases, right? When we look at certain cultures, we know that certain diseases are more prevalent. So I'll use Hispanics as an example. Um, so high rates of hypertension, obesity, diabetes, right, in that Hispanic population. So there are certain things that we know to look for, right, as we work with those populations, right? So these are all things that, as part of a culture, um, we want to pay attention to. And I remember when my kids were little, um, took them to the pediatrician, and this was I don't remember. I think this was before I had become a nurse. No, maybe it was after, but didn't probably click in my head. My son was like 8 or 9, and the doctor ordered cholesterol screening. I was like, he's 9 or 8. I'm like, why are we doing cholesterol screening like on a 9-year old? Um, and the doctor just looked at me. He's like, because he's Hispanic. And I was like, and at first I was like, well, so what does that mean, right? It didn't dawn on me that we would start it that young, right? That we want to go ahead because of the high incidence, because of his ethnic background, that puts them at high risk. And so all of my kids, they had started training for things like that at a younger age, which was something that, but these are things, right, that we have to look at when we look at the incidence of specific diseases within certain cultures. Let's see. Um, Wellness. So we talked a little bit, you mentioned things, like some may not want to take certain medications. When we look at the prevention of illness may be different. And that's why I was saying, like, some people believe that illness can be prevented, right? Um, and in certain cultures, there may be rituals and um, things like curanderos that may be used to perform rituals, right, to prevent diseases. Others cultures actually believe that prevention of diseases is an attempt to control the future, and that is something that is, I don't know, not frowned upon, but they think that, there's no way to control the future, I guess, is where I'm trying to go with that. So why would they go get immunizations? Why would they get cholesterol screening? Why would they go get their blood pressure screenings, right? So they may seem that it's, not necessary. Um, curing illnesses. So this too, like I was saying, some cultures believe that illness is the result of, something that, we did wrong in the past, right? It's kind of like our punishment. Some blame spirits. So my mother-in-law, one of the big things, like when my husband and his siblings were little, when they got sick, she believed that that was the result of somebody giving them the evil eye. Okay, so there were, rather than traditional medicine, right, there were some rituals that she would use, and I don't remember all of them, that she would do when they got sick, um, to, counteract the effects of that, evil eye. So these are things that we really do need to consider when we're caring for clients within certain cultures. Others believe that um, there's special foods or combinations of foods and herbs that can prevent or even cure illnesses like what is it, like the hot and cold foods, right? And then there's other cultures that don't see any balance between diet and health. So variety, complementary and alternative medicine. So this is something that is really starting to become more and more prevalent. So complementary and alternative medicine focus on assisting the body's own healing powers to restore body balance. And so, like I said, this is becoming more and more popular. And it's not using regular medicines. Like, so we're, still going to follow the medical treatment plans, but we may add some of these alternative options as part of it. And, some of these things could be like your acupuncture, your acupressure, massage therapy is also very common. Or it could be using herbs and vitamins and minerals in combination to the traditional medicine. And there are actually a lot more of these providers out there that are providing and assisting with this. Um, Modesty is another one too. And it's like somebody was saying, right, having the same sex care providers, right? Not in this doesn't matter what culture you're a part of, right? Some people get, they're embarrassed. About having to show certain body parts or even discussing certain, bodily functions. So, we do have to be mindful of that. And then mental illness. Have you guys taken, or you're taking mental health this term, correct? Yeah. So mental illness, right? So there's still a lot of stigma when it comes to mental illness in certain cultures, right? And so for whatever reason, some may kind of try to hide the mental illness or they won't receive treatment for mental illness because of that stigma that is there. And this, of course, is something that is very difficult to overcome. We may have, it's about a lot of education, reinforcement that there is help that is out there, that it's something that is very treatable, right? That we can help with them. So just here in the United States, it's projected by the year 2060 that nearly 57% of Americans may be members of an ethnic minority. So Hispanic, 18%, Asian, 6%, African American, 12%, your American Indian and Alaskan Native, 1%, and then the white population, 61%. So now this is often, it's interesting, like the area that you live in, right? Some areas are going to have higher populations of certain cultures than others. So when I lived in Virginia, um, it was a different population up there than it is down here. And so my husband like is Hispanic, and so there's a very high Hispanic population here in Texas compared to where we were living in Virginia. Um, and so I'm trying to think, I mean, there we were the area that we were when I lived in Virginia was very culturally diverse. It was a lot of military in and around the area as well. So there are lots of different cultures, lots of different ethnicities in that area. Some of the areas, and then of course New York is going to be completely different, right? Some areas, if you're more rural, you may not have as diverse population as more of like the city areas. But that I see changing as well too. Um, as you go into practice, you are going, and you may know your community really well now. And so as you continue to go into practice as well, um, so um, you'll learn more about the clientele and the different cultures that you're going to be exposed to. So again, it's about who you're going to be working with. And you're not ever going to know everything about a specific, I mean, you may know more about your culture, but as far as other cultures that, exposure is going to be key. But the best way that you can always find out is to always ask. And that's part of that initial admission assessment. It's part of, the interview that we provide for our clients to make sure that we are incorporating their cultural practices into their plan of care. So philosophy of individual worth as it applies to healthcare. So again, this is what I've been saying. We want to include the uniqueness and value of each human, right? So when they come in and we're doing that assessment, we're looking at all their practices. We're looking at their diet, their health beliefs, their health promotion beliefs. What can we do to include their cultural beliefs in their plan of care? And it is part of them, so we do need to do it as long as it is safe and it is not going to interrupt or cause any disruption in plan of care for other people on the unit, right? We're going to try to, and that includes some of their foods and other customs that may be necessary to assist them in their recovery. Everybody has the right to live according to their own personal beliefs and values. Again, as long as it doesn't interfere with the rights of others. So when you're planning care, in your, wherever it is that you're going to be practicing, you want to try to get as much information about them. The larger the cultural, group that you're going to be surrounded by, get, all of the information. There's references you can, there's things like Google, and you can go on and you can look um, and do your own research and looking at some of the customs and some of the beliefs of some of the more populous cultures that are in your area. And those are always going to be a really good foundation. Okay, again, like I said, not all members of a specific culture are going to follow all of the same customs and traditions, right? They're going to be individualized to those patients. So that's where you want to try to avoid stereotyping that group of people into one big group, right? There's differences amongst everybody. And in some cases too, you may belong to a certain culture, but you don't follow any of the practices within that culture, right? And they're completely different. Um, so, when we look at it, it's always about providing individualized care. So, for example, I grew up as a Polish Catholic person in New York. Okay. So, spent majority of the time as a younger person with my father's family. They are 100% Polish. My babcia took us to church. It was twice a week. We went on Wednesdays, we went on Sundays. Very strong Catholic background. I have two great aunts that are nuns. I have an uncle who's a bishop. Um, but as I've gotten older, okay, I don't, religion is separate from this, but I may make some Polish food like every once in a while, right? Especially some pierogies and kielbasa and things like that, maybe some stuffed cabbage. But other than that, I don't really follow any of those Polish cultural things that I used to follow when I was a child, right? And I didn't, grow up teaching. When I grew up, I didn't, raise my children in that environment, like in that Polish culture. And so, just again, just because someone belongs to a specific culture doesn't mean that we are going to, um, use all of, do everything within the culture. And I would say people are like, well, do you like this and do you like that? I'm like, I don't know. Um, and again, the big one too is I'm going to stop sharing for a minute is avoiding those stereotypes. Um, it is and I'm going to say it, every one of us have our own biases. We have our own beliefs. We stereotype whether we think we're stereotyping or not, right? Um, it is, our goal as nurses is to provide the same quality of care no matter who is walking through our door. So we always want to try to avoid applying, any information from one client of a culture to all clients, right? So just like I said about that Jehovah Witness client, right? Um, Again, not all Jehovah Witnesses are going to refuse that blood transfusion. So we always treat everybody as an individual with their own specific needs. Um, Hold on. Okay. Um, some information about cultural groups may help to explain their behavior, but it doesn't always predict their behavior. Again, never make assumptions. Never make assumptions. And another big part of this too is I'm going to ask a question. What happens when, and we're, setting up that plan of care? What happens when we don't take culture into consideration when setting up that plan of care? What can happen?
Mistrust, they might not trust you no more.
Okay, they may not trust us anymore, right? They may feel like, we're not providing the care that they deserve, right? Because we're not incorporating any of their beliefs into their care. Okay, what else? They may not make the necessary changes, right, in order to get better, right? They don't believe, um, if I'm sorry, let me rephrase that. If we don't do our due diligence in understanding what their beliefs are about their specific illnesses or their conditions, then, we won't understand why they may refuse treatment, right? So, like I was saying earlier, some cultures believe that people get sick because of something that they've done in their past, right? Almost as a punishment. This is like, I deserve this. I deserve to get sick because I've something that I have done, right? So they could refuse treatment. Education is always key, right? You can't ever force anybody to accept care, right? We can just provide the education and make sure that, they understand. It also can potentially lead to us thinking that they're just being difficult, right? If we don't understand their reasoning behind refusing care or not participating in their plan of care, right? Sometimes it would be like, well, they're just being difficult. They're just, they don't care about themselves. They don't want to get better, right? And so we can, almost, think that they're just being difficult because we're not doing, because we didn't do our due diligence with them. And then think about personally, right? So think about it. anytime I don't know how many have ever had a whole lot, or how many of you have had a whole lot of contact with the healthcare system, but you go into the hospital, whether it's even if it's in an emergency room and or an urgent care, right? They're always going to ask, is there any religious beliefs, right? That may affect your treatment. There are any cultural beliefs that may affect your treatment. It is extremely important for healthcare providers to know if any of these, if there's any, adjustments in the plan of care that need to be made based off of culture and religion, right? Our goal is not to offend people, right? That isn't our goal, right? Of course, we want to make sure that we're providing safe, effective care that is beneficial for the client. Um, but, we do have to take into consideration that, they may not do things based off their culture. So again, it's really understanding what their belief system is and how that is going to tie into how we care for them and how they respond to the treatment that we are providing. And again, that's why that patient is always going to be the center of care. There are a lot of practices that are culturally based that we as Western medicine may not agree with. We may not even understand it. As long as those beliefs, those practices are helpful and not harmful, it is okay, right? Some may burn incense or use certain herbs and, vitamins, minerals, and other practices. Um, as long as it's not going to cause harm for them, then we can continue with those practices. I don't see anything wrong with getting a massage every once in a while, right? Um, but seriously though, with that, we want to try to preserve some of the beliefs that they have, and incorporate into the plan of care because it also helps to increase compliance, right? When we do incorporate those things. Now, there are going to be, there may be some harmful practices as well. And those are things that we have to look at, and we can try to repattern those. So let's see, I'm trying to think of a good one. Let's just use diet. Okay. We'll use, and it may not be necessarily harmful, but think about it. Okay. So where I was mentioned earlier, right, there's a high rate of diabetes in the Hispanic population. Okay. Especially as they get older, right? Anybody know anything about the Hispanic person's diet? Anybody know about Hispanic diet?
I
Okay.
know they don't they eat a lot of spicy foods.
A lot of spicy foods, a lot of tortillas, so a lot of carbs, right? Um, they do eat a lot of fruits and vegetables as part of their diet as well. But if I'm eating, and tortillas are normally with every meal, breakfast, lunch, and dinner, okay?
Mm.
So looking at that, right? If I have somebody who's a diabetic and we're looking to lower glucose levels, right? How do we fit those dietary practices into their plan of care? Because if I tell a 70-year-old Hispanic male, okay, you can't have tortillas anymore. How well is that going to go over, right? Are they gonna just stop eating tortillas because I said no? Absolutely not, right? So, it you want to repattern it. You don't want to say you can't have this anymore. Okay, how do we fix this so that you can eat the foods that you still enjoy that are culturally significant to you, but then still not have, right, any long-term, negative effects. So things like that, right? We look at, we want to make sure that we're providing that culturally appropriate care. Again, if it's a pattern, so I don't know, there are negative things out there, like some, and don't know exactly who, where, when, why, but some cultures will take Vicks and they'll put it under the baby's nose, okay, to help. breathing to help congestion. And I love Vicks. Vicks is a great product, and menthol works great, right? But it can cause irritation. It can actually burn the skin underneath the nose. So how do we repattern that behavior? Okay, so we repattern by explaining that it's potentially dangerous, okay? But it is okay to use it on the chest, right? Rubbing that menthol into the chest can help to relieve congestion, help them to feel a little bit better, right? So it's about taking the what we know or what they're telling us about their cultural practices and then just repatterning it, right? Trying to find a better, safer way, right? To still keep, their, practices, but just, doing it in a safer way so that it's not going to cause injury. And that's the only one I can think of. There's a lot more out there, right, that we may have to look at some of their practices and just try to offer alternatives just to make it a little bit safe. But with all that being said, just providing culturally competent care is something that we all have to make sure that we are doing. Um, and that's why that, like I was saying earlier, that self-assessment is super important. Recognizing your own or our own cultural biases are, the things that we believe are stereotypical. So coming to terms with that. Again, each person in of a specific culture is not going to be the same. They're going to have different practices, different beliefs. So we just make sure that we treat them as an individual. All right, so let's do a quick review of culture. What is ethnocentrism? Tell me what ethnocentrism is.
It's like thinking your culture is better than somebody else, something like that.
Right. Good job. Your culture is the best, right? My culture, my Polish background is better than everybody else's, right? All
Mhm.
right, cool. What is a stereotype? And give me an example of a stereotype. I got quiet all of a sudden. What's a stereotype?
A stereotype is grouping people together because of something that I'm saying it wrong. Like
No, you're
basically like basically I was saying it right, but I got stuck.
you
Like
got stuck.
basically judging people off of something as far as it could be anything, like how they look or their background or their
Right.
culture.
Very good. So it's an inaccurate generalization, right? All members within a specific group, right?
Mm.
So let, you know, so like, think of like all blondes are airheads, right? A lot of people,
Mm.
right? All the
Or
blonde
like
jokes
they
that are
say
out
all
there.
white people racist.
I'm sorry.
I said like if you was to say all white people are racist.
Exactly. Exactly. Right. It's an inaccurate generalization. Redheads have more fun. No, we don't.
Uh,
Okay. So very good. So yes. And then, we talked about prejudice, which is intolerance of another cultural group, which often leads to discrimination, right? And discrimination is withholding rights and privileges from those of another cultural group. What else? What, trying to think of what else we talked about. So yeah. All right. All right, we're good, I think, with culture. We'll go to, so we'll talk about spiritual needs. Um, so chapter 11 is spiritual needs, caring, and religious differences, looking at the PowerPoint. And so I will share my screen.
that was chapter 10 we just went over, right?
Yes, that was chapter 10. So spirituality and religion are, they're closely related, but they are completely different. Okay. Spirituality is part of everybody. Everybody has spirituality, though we may not always fall into a formal religious group. Okay. So spirituality has to do with experience, beliefs, and values that give a person strength and hope. Okay. And so the spirit gives meaning to life. And it is hopeful that your spiritual self grows, matures throughout one's life. It is not a formal experience, okay? It is something that is completely individualized. Religion is different, okay? Religion can be spiritual as well, okay? But religion is a more formal experience. There's usually specific beliefs and rituals that accompany that religion. Um and having spirituality doesn't always mean one participates in a religion. Okay, so while they are similar, they are not the same. All right, so, again, I was saying earlier, just to use myself as an example, I was born and raised in a very strong Polish Catholic family. Like I said, Babcia, which is my grandmother, we went to church twice a week on Wednesdays and Sundays. Lots of, and so to me, like I kind of look around, but it's very similar to some of the Hispanic traditions as well, with the crosses and the other, what are the statues, there was always an infant of Prague, there was always crucifixes hanging and other rosary beads and all sorts of other religious regalia around the house. Um, and so within the Catholic faith, there are specific, all of a sudden, I can't think of the word, but there are specific rituals, there are specific beliefs that we grew up, sacraments, that was the word. Sorry, I couldn't remember the word sacrament. Okay. For us, so sacrament, there's 7 holy sacraments. So things like being baptized and our first Holy Communions and our, confirmation. And then as we get older, there's different tracks, right? We can take holy orders, which would be becoming priests or nuns, or we have marriage, which is another holy, one of the sacraments. And then there's forget what the other ones are. Don't judge me. It's been a long time. But then, of course, last rites, right? When somebody is dying, and anointing of the sick. There we go. So there's specific rituals and practices, right, within that Catholic religion. Okay. And obviously, each religion is going to have their own. So being spiritual is a little bit different. There still may be rituals and practices that somebody uses while being spiritual, right? It is all dependent on the person. So again, they're very similar, but they are different. We also have spiritual dimension versus the emotional dimension. Okay, the spiritual dimension of a person, this is like what gives us insight into our meaning of life, suffering, as well as death. It is the relationship of a person with a higher power. Okay, whatever that higher power is. Okay, is it God? Is it Allah? Is it a spirit? Whatever that higher power that, is there that they believe in. The emotional dimension, this is how people respond, and deal with feelings. Okay, whether it's joy, anger, sorrow, guilt, remorse, love. Um, and so that is that emotional dimension. And these often kind of go hand in hand with each other. And this is why it is when we're, looking at providing that holistic care that we are including this in our initial assessment, right? It's not always about what hurts, what doesn't feel good. what disease process is affecting us today. We have to look at this, and the culture as well, but we have to look at, how spirituality, how religion also is going to play into their care. So when we look at spiritual care, it helps, it involves helping clients develop awareness, and maintain inner strength, self-awareness, meaning and purpose to their life, their relationships with others, as well as that relationship to the higher power. Um, And so, again, we have to incorporate this into their care. So, who needs spiritual care? Anybody that comes into contact with us, okay? So, they come in, hospitalized, they're in pain, they have chronic or incurable diseases, those that are dying. And it's not just about our clients, right? It's about our family members, right? So families are going to need spiritual care as well, especially think of somebody that has just lost a loved one who has experienced um, a traumatic injury or an undesirable outcome of an illness, or those that have just emotionally lost control of their lives or of themselves. Sorry. Um, So crisis situations, right? Those are, can occur in all healthcare situations, regardless of where you are in a hospital, in a long-term care facility, in a clinic. Crisis situations can occur. Generally speaking, we're going to probably see them more in an acute care situation, right? Because those are more acutely ill. Um, so we got to have information. Okay. So the first step to providing spiritual care is to be comfortable dealing with spiritual matters. And that can be a difficult for some people because not everybody is spiritual, not everybody has a formal religion that that they follow. Or, my spirituality may be different than your spirituality, right? What I believe and how I feel about a higher power may be different. So some people find religion, um, or spirituality a difficult concept. So being comfortable with talking about it. I will tell you when I was first, so different for me, like I said, I was born and raised Catholic. I went to Catholic school my whole life. Okay. So from kindergarten until I graduated high school. Um, we, and I don't know if it was just the how I was raised, but we weren't very, I don't know how to explain this. We weren't really open outside of our homes with our religion, if that makes sense. Like, I mean, we went to church, we prayed before meals, we prayed before we went to bed, but in other situations, it wasn't like, oh, I need to stop and pray. Like, I need to do this. Um, and so when I first became a nurse, and met some members and worked with clients, with different religious backgrounds, um, that were very open, and always wanting to, like I had a couple would grab my hand, it's time to pray, we need to pray over this, and I'm like, oh, okay. Like, what do you mean, what's wrong? Or even singing hymns and things like that, like that isn't how I grew up. So when I first came across that, it was a little bit uncomfortable for me. Like when a patient would say, do you mind, just sit here and pray with me, I'd be like, I don't know, like, I guess, like I didn't know what to do. Um, and so again, being comfortable now, if somebody asks me to pray, I'll be like, I will sit here and hold your hand if you want me to hold your hand. I may not know the prayer that they are saying, right? But you're providing a sense of comfort for them. And then like after that, the second one is being aware of your own spirituality, okay, and how that spirit, and that's, the spirit that is the essence of you. Again, everybody's got different levels, and being aware of your spirituality, what are some things, how do you cope? Okay. life hits you with something hard. Um, what is your coping mechanism? Give me an example. What are some of the, you guys are, I'll ask you guys a question. What are some of y'all's coping mechanisms? What happens when you're stressed or something happens? What do you do?
Go to sleep.
I cope with music.
Okay. Natasha, did you say go to sleep?
Yes.
Okay. Is that a positive coping mechanism, Natasha?
Can't Yes, because it's like a factory reset for me to think on the situation differently.
Okay, it's a factory reset. I like the way you said that. It's a factory reset. Okay, we got music.
I like to
Go
color.
ahead. I'm
Color.
sorry.
I like to color.
You like to color? Oh, that's a
Yeah.
good one. Me too. I like to color. I love coloring.
Writing.
Reading. Okay. So good. So identifying coping mechanisms. Other things, who do you go for support? So when something hits the fan, who's the first person you call? Is it your spouse? Is it your mom? Is it your best friend, your uncle, your brother, your cousin, right? Um, who is that source of support for you? And other things about, being aware of your own special, your own spirituality, right? Do you feel loved? Right? Whether, and that's always a big one. It's other things like, what brings you joy, right? What makes you truly happy? Do you believe in prayer? Or, that higher power? And what is your relationship with that higher power, right? Is it just I need to pray every day, a couple times a day, or is it on just those times that I'm having a really hard time coping, and that's when I tend to pray more. Um, are you religious, right? Do you belong to a specific religious affiliation? So Catholic, Christian, Baptist, Seventh-day Adventist, um, what else? Muslim population, trying to think of what else. Um, There's so many out there and I can't think of any more. Pentecostal, right? So there's a lot of different religions. Do you affiliate with a specific religion, or is it like I said, I'm Catholic, born and raised, so like I don't go to church anymore. I am much more spiritual now than I am religious. So, right, it's all of these things. So you becoming aware of what your spirituality is. Um, so before we go any further, let's take our break. Be back at 3:30, 3:45.
Okay. Dominic, are we on break?
Yes, come back at 3:45.
Thank you.
All right. So we're dealing with clients and families, okay? And ensuring that we are trying to meet the spiritual, the religious needs of that family. So how do we do that? So the first is always going to be ask questions, okay? Just like with culture, you're not going to understand every spiritual or religious requirement or need of our clients. So it is always about asking those questions. So we do that admission assessment. And if anybody, like I said earlier, if anybody has ever been to like the emergency room in the hospital, always ask, right? Are there any religious considerations that, need to be taken into consideration? While providing your care. Show interest. That's always a big one. Show interest in what they are saying. And, Ashley, can you mute yourself, please?
Oh, I'm sorry.
LaShawn, Janika, Linda, Jamalatu, are you guys there? So always show interest. I don't know. I mean, I think it's interesting to learn about other people's beliefs and how that is going to play and interact with their care. So, show interest, not just, as part of checking a box, right? You want to actually show interest. Listen with an understanding attitude. Not everybody, we're not all, not everybody has the same beliefs, the same. And so understanding that this is something that is important to them, and, make sure that we are incorporating that. Respond naturally to spiritual concerns. No matter, sometimes it may seem silly, some like, oh, it seems a little bit silly. Okay. Not always silly, right? Just different, right? It's something different from us, and what we may believe, or what we understand. So, you know, and it's part of something. It is part of their person. And so we need to take that into consideration and be respectful of that. Help clients face reality of with hope, right? So this is, hey, it's okay, right? To what's the word I'm looking for? To have that higher power, believe in that higher power. It's, asking them what are some things that we can do to assist them in feeling better, whether it's, putting the Bible up in the corner of the room or having the crucifix next to them, their rosary beads, or something that is, something that is part of their what's the word I'm looking for? That's part of their belief system to help them, to provide comfort and care to them. Allow families to participate in caregiving, in certain, just like with certain cultures, spirituality and religion. Family members also will help to participate in caring for each other. Avoid false assurances. Talked about that within, when we talked about communication, right? We don't always think it's going to be okay, right? Because we don't know if it's going to be okay. So we want to be really careful with that. And then be supportive and empathetic. And I will say, like I said earlier, not everybody is comfortable with spirituality and religion. And it's about your person, understanding again your personal beliefs, and being able to just, put those aside so that we can provide the best care for our clients. Um, and like I said, it may, you may have patients that are going to ask you, you know, can what's the word I'm looking for? Pray with me, right? Or even sometimes hold my hand, while the patient is playing, or sitting with them while they are while they are praying. And sometimes just having your presence is something that may be, just enough to kind of give them a little bit of comfort while they're, performing their tasks. Others, they may ask you to, read from a prayer book or read a verse from the Bible. These are all things that, like I said, people may ask you to do with that and do with, with them or for them. So that's why I said, being comfortable with it, being comfortable with talking about it. And, that will often help you to, work better with your clients. Um, Spiritual care interventions, always ask those open-ended questions. We know open-ended questions are going to give us the most information, right, from our patients and so ask, those open-ended questions so that they can give us the information that we need to incorporate that into their plan of care. It helps with trust. It helps with, improving outcomes. So just know that, um, it's an important part of it. Don't give advice or lectures. Okay. Um, if somebody says they're an atheist and they don't believe in God or a higher power, right? And you have a very strong religious or spiritual background, this isn't the time to say, well, that's not a good idea, to preach about God or something along those lines, right? Um, Always be yeah, or avoid trying to change a person's beliefs, right? We can take that back to culture and ethnocentrism, right? They may ask you about what your beliefs are. Generally speaking, we don't offer a lot of personal information when we're caring for clients. You can say, that you believe in a higher power, but you don't want to try to change their beliefs. Also want to be aware of those nonverbal messages. So part of communication, it's recognizing, those nonverbal signals that clients are sending. We want to make sure that they're nonverbal and their verbal are congruent, that they match. And then understand the client's feelings, but avoid adopting them for yourself. Okay, so again, how one person feels is not going to be something that somebody else feels. And, we don't, it's the difference between empathy and sympathy, right? Expect to learn from the client, right? The more questions you ask, the more involved you get in that building that therapeutic relationship with your client, right? You're going to learn things, and these things that you learn, whether it's spiritual, whether it's religious, whether it's whatever it is, you're going to learn from your patients. Okay. You may even learn some coping mechanisms that may be more effective for you. It is, like I said, it is okay to pray with your client if they ask you. It is okay to read to the client if they ask you. A nurse is able to baptize a client if asked. So let's say you have a client that is in an imminent condition, or maybe, a trauma or something along those lines, and they are in a spiritual distress and they ask you to baptize them. That is okay. A nurse can do that. Doesn't make you a priest, doesn't make you a nun, a reverend, a pastor, any of those things. You don't have to be that. Um, like I was saying earlier, some of those rituals and customs that are part of each religion or even a spiritual person, that may be something that is very important to them at the time. And it is okay, right, to baptize them. Anybody know how to baptize a patient? So, this is, um, there's different ways. Um, that you can do emergency baptism. Um, and so I will just give you like my perspective from like a Catholic. So, if we have to do an emergency baptism, one of the first things that we are going to do is pour water over their forehead 3 times, so if you have like a little cup of water, just put like a little couple drops on their forehead. And then while you are, saying, I baptize you in the name of the Father, the Son, and the Holy Spirit. So you'll do a drop of water and you'll kind of say that all at the same time while making a sign of a cross on their forehead. Um, Obviously, if they're getting baptized in church, right, we're going to use a holy water and other things. But again, it is a sign of comfort for somebody. It isn't an elaborate ritual. It can be something that is done really quickly, but that's all the process is. I baptize you in the name of the Father, the Son, and the Holy Spirit, and you just make the sign of the cross on their forehead. Other baptisms, other religions may have different ways that they do baptisms. Um, but really, the same simple one will work for anybody if they are in distress. You also want to assist with the client's participation in their religious or spiritual rituals. So, you know, um, if there's a requirement for them to pray, right? A certain amount of times per day, right? So, making sure that, and I don't know, is anybody Muslim? Any Muslims? So, do you do like the prayers, like the prayers every day? I don't remember how many times a day they pray. Are you typing? So I know like with Muslims, right, it's 5 times a day, right? And you have to is it face Mecca, right? When you pray. So, even being able to assist them with that process, right? Um, so Okay. So however, these are things that, when you're doing that assessment and you're talking to your clients, that you're going to ask these questions. It could be making sure that their Bible is nearby, or, making sure that they have their rosary. And again, I'm just talking Catholics because I know that well. And so, a lot of our Catholic, especially older Catholics, they get a lot of strength from having those rosary beads, okay? And so, or it could be other, religious emblems. It could be like the little prayer books or, any other, whatever it is that comforts them, the Torah, right? Whatever book, whatever symbol it is. And helping them with that. Generally, right, we're not going to light a whole lot of candles and burn incense in a hospital, right? But there are other things that we can do to help them. And always protect, and this is a big one. And I get frustrated with this. And again, this is just me, right? Growing up, Bibles, okay? You go everywhere now, there's a Bible, right? Go to the hotel, there's a Bible in the drawer, right? Um, a lot of us, like I have the same Bible I've had since I was a kid, okay? It is something that is very dear to me. It's something that I have a lot of respect for. Yes, it's a book, right? To someone who is maybe a non-Catholic or doesn't have the same beliefs as me may just see that as a book, right? As something to not worry about. I get really uncomfortable when I see Bibles just kind of thrown around like it's not a big deal. Like we were taught we couldn't even throw a Bible in the trash can, okay? Um, and my husband laughs at me because I have a Bible that had gotten ruined when it's a long story. It got ruined in a flood. And so of course you can't even open it anymore. The pages are all stuck together, but I still have it. Why? Because I can't I was taught I can't throw it away, right? That it is what's the word? I'm sacrilegious for me to throw this Bible away. So I know I have it, so I don't because I don't know what to do with it. Okay. Um, so just be respectful and protect their articles. Don't let them get, pushed around. Don't let them get dirty. Don't let them get ripped or, tore up. Don't, make sure that any of their other articles, whether they, use prayer cloths or other things, make sure that we're respectful and we care for these, so that they don't get damaged or, not usable. The pastoral care team. So the pastoral care team, a lot of the hospitals will have a pastoral care team. And this is ministers, priests, rabbis, and sometimes like nuns or sisters, which are your consecrated religious women, and also, other religious organizations as well as laypersons. So, for an example, in the Catholic Church, we have deacons, okay? And deacons are not priests. They, like priests in the Catholic Church, right? They don't get married, they don't have kids, they remain celibate for the rest of, for their lives. Whereas deacons are lay people. These are often, not all of them, but they may have families, they may be married, but they have taken a form of religious orders. And so, all of them are educated to meet spiritual needs in a healthcare setting. So even, for example, I used to work with a nurse when I worked in peds. One of the nurses that I worked with, we went to the same church. She decided to get her, I know it was her master's degree, and I want to say it was pastoral studies, but I could be completely wrong with that. Um, but if you remember in community, right, we have those, um, oh my gosh, why can't I remember? We do have nurses that work with the parish nurses. Wow, I can't believe I remembered that. I couldn't remember that. We have parish nurses, right? Those are nurses that have gone and gotten additional training to work with members of the congregation. And so that is what she does. So she retired from nursing, like from like clinic nursing or active nursing, and she went into and became a faith-based nurse within the church. So it's more of a community-based nursing. But again, the members of the team, they work with nurses, they help to provide spiritual care to clients. And so, when you walk in, when you're admitted to the hospital, they're going to ask you about your spiritual needs. They will ask you, would you like a member of the pastoral care team to come see you? That is something that they will absolutely do. They Patients also can reach out to their own church or their own spiritual provider, and that provider is more than welcome to come into the church as well. Um, and there may be some spiritual interventions, right, that can be included into their plan of care as well. But again, a lot of people, they find comfort in, talking to a religious person, a priest, a minister, rabbi, whoever it is. They find comfort in that. They can, do confessions, they can, what else? And they can do anointings. They can sit there and pray. Um, what else? Provide communion. So, right, lots of different options. And again, it's often very comforting that for that person. So use my mom as an example. So my mom, right before she went into hospice care, she was in the ICU and my again, you grew up very Catholic. And so she asked for a member of the spiritual care team to come and, to talk with her. And in the process, there was, mom didn't really ask for much. She did ask for a new Bible. Um, and so they brought her a Bible. And then one of the volunteers from the church actually brought her a prayer shawl. And it was absolutely beautiful. It was like hand knitted. It was something that she had made herself. And so that was really, that was really special to my mom. And so when she would, pray, even though I wasn't raised like that, but when she would pray, she would put her prayer shawl on and it just gave her some comfort in those last days. Um, so again, the spiritual or the pastoral care team, it can be a very effective. And meeting the spiritual needs, regardless of their religious beliefs. All clients have a spiritual self, whether, like I said earlier, whether they have, formal religious affiliation or if they are just spiritual. All of us have some sort of a spiritual self. They have spiritual needs, they have personal spiritual practices to meet those needs. And when we look at spirituality, it's not about a formal religion, it's not going to church. And so their spiritual practices are usually going to be individualized, right? Some people gardening, reading, prayer books or daily devotionals, taking a walk in a park, being around nature, right? Those are all things that can be potentially beneficial, or that's how they practice their spirituality. Meditation is another one, but those spiritual practices help them to develop an awareness of self as well as an understanding of the meaning and purpose for their lives. And so we always want to make sure that we are meeting those spiritual needs while they are in our care. Religion, a little bit different. So we look religious denomination as just the organized group of people who share a philosophy that supports their particular concept of a higher power. Okay, so here in the United States, there's a lot of practicing religions, okay? Hindu, Jewish, Buddhist, Muslim, Lutheran, Catholics. You have your Jewish, or I said Jewish population. You have your Quakers, you have Presbyterians, Seventh-day Adventists. Oh my gosh, you have the Mormon Church, which is not Mormon anymore. It's what is it? It's Jesus Christ of Latter-day Saints, your Baptists, Jehovah Witnesses, Episcopalian, Christian Science. Christian Science, I will honestly tell you that is one that I don't know a whole lot about. I had done some, like I started to do like I'll try to understand it a little bit, but don't know a lot about Christian Science. And then of course we do have some that are non-denominational, right? A lot more churches that I've noticed, and I thought that's actually pretty cool. A lot more churches are popping up that are non-denominational. They don't follow like a specific religion practice, but they're a lot more inclusive, right, to kind of members from all different types of religions. Um, Atheists, they don't believe in a higher power at all. Agnostics, they believe that the existence of a higher power can neither be proven or disproven. So again, atheists, they don't believe in a higher power at all, whereas agnostics, you can't prove it, you can't prove it. So, who really knows this if it's there, but it's not a disbelief. rituals and practices, and we've talked a little bit about these as well. So rituals are a series of actions that have religious meaning. Okay. And so that brings the security of the past into a crisis situation. So pictures, icons, herb packets, rosaries, statues, jewelry, other objects can affirm their connection with that higher power. The value of the client's rituals and religious practices is determined by their faith. Okay, so their level of faith is going to determine how important this is to them. And there is a nursing diagnosis, okay, that relates to spiritual distress. And so we see spiritual distress in clients that are unable to practice their religious rituals. All right. So if my grandmother, my babcia, she lived to 97. She lived home by herself in Brooklyn. Um, and it started to get and she never had any, mental decline. Hers was more physical decline, and it was hard for her to get out of her home and go to church. She never drove, okay, and the church literally was only like a block and a half up from where we lived, and so she was always one to walk to church. But because she couldn't get out there was, stairs. So either she had to go down the stairs to get out the front door, she had to go up the stairs to come out of the basement onto the sidewalk. And so it was very distressful for her. She could not get to church. And it was really causing her, I mean, she was very distressed. It was causing her a lot of distress and she was very uncomfortable. She was upset. She was becoming depressed. Um, and so, really, all it took was a nice phone call. We called to the church. We talked to the priest. And so, what the priest did was the priest started coming to her house. Now, obviously, it wasn't going to be a full Catholic mass in her living room, okay? But the priest made a visit to her twice a week and brought her communion, and that was enough, right? He would spend like an hour with her, and she could do confession, she could get, communion, and that was enough to relieve her distress. Um, so again, that can, like I said, it could be very stressful for them. And spiritual distress is also observed in clients who experience a conflict between religious and spiritual beliefs. Okay. And so there's a lot of these. And so I will use Catholicism as an example. Okay. So couple beliefs that I grew up with. Although I will say that the church has gotten a little bit more lenient now, but I'm just going to bring them up. So, for one, Catholics did not believe in the use of birth control. Okay. That could be a conflict, right? Not every person wants to have 20 kids, right? And so there had to be some sort of control. So that is often something that would be a conflict. Another conflict would be between religious and spiritual needs would be rape considering an abortion, right? Everybody has personal beliefs about abortion. I'm not gonna, I'm not trying to start a debate, right? But although now it's just a little bit out there anyway, but um again, Catholics didn't believe in abortion. So what happens to that Catholic woman that gets raped and becomes pregnant, right? That could be a very big conflict, right? Don't want to carry a child that is the result of rape. But yet my religion tells me that I'm not allowed to have an abortion, right? So what happens? That can cause some spiritual distress as well. Um, I will tell you another story. One of the things with spiritual distress is when my mom entered into hospice care. One of the big things that my mom had mentioned to the hospice nurse when she came and did her admissions assessment is that she would like the priest to come and give her last rites. Um, and she didn't actually make it as long as we thought she was going to make it in hospice care. And I remember the day that she actually passed, I went in to check on her in the morning because it was Mother's Day. So I had gone to the store. I had got her favorite, which were yellow roses, and I went to bring them into her room. And I took one look at her, and I just was like, I knew that she wasn't going to make it the rest of the day. And so I don't know I don't know even how I remembered it in the moment. And I was like, oh my gosh, she never got her last rites. And so, of course, all my kids came and my sister was there, my brother was there. Um, and I called the church and I asked the priest to come give my mom last rites. And she wasn't unresponsive, but she wasn't responsive either. Like if I said her name or I touched her hand, her eyes would open, but she wasn't like talking or anything like that. So finally got the priest to come do her last rites. I feel a little guilty about this, but he came in, he gave her last rites, he left. She knew he was there, and she passed away within 30 minutes of receiving her last rites. So I knew that that was a potential conflict for her. And the fact that we were able to, I mean, I could have done her last rites for her, but I know having a priest, right, a member of the clergy perform them would have been, is going to be the most comfortable for her. Um, so that's why, some of these things it is very important to people that their religion and their spirituality is respected. Um, Client and prayer, um, you know, prayer is powerful. Prayer can be very powerful. It is a spiritual practice of some individuals, whether or not they are members of an organized religion. Okay. Doesn't mean you have to go to church every Sunday to pray. Okay. A lot of us learned prayers as we were growing up, and those are things that we carried into adulthood. And so, prayer can be very comforting. It can be stress relieving, right? It also helps them cope because sometimes they feel like it's just they have somebody to talk to. Um, and I, and then another area of spiritual distress, right? Somebody gets diagnosed with a terminal illness. Why is God punishing me, right? Why is God doing this to me? What did I do to deserve this? And that can lead to some spiritual distress as well because they've always had maybe a strong faith in that higher power. And now they feel like they're being punished for some reason. Why isn't God helping them? Um, and again, it can be another, part of that spiritual distress. Again, you can help your client pray if you are asked. So religions in the world, Christians 31.2%, Muslims 24.1, unaffiliated 16, Hindus 15.1, and Buddhists 6.9. I will say out of all of those, Hindus and Buddhists are probably the two that I know the least about. Although I know Buddhists are very peaceful, as are the Hindus. It is something that I really would like to know a little bit more about them. Avoiding false assumptions and stereotypes. It is a false assumption to expect that all individuals of a specific religion or belief system will believe exactly the same just because we all belong to the same, right? Like I said, I grew up in a Catholic church. And one of the reasons why I left the Catholic Church is because some of the beliefs that I have about God and higher power do not match what I was taught as a Catholic. And these are things that, my thinking has changed, right, as I have gotten older. And I will tell you though, the Catholic Church has become a little bit more progressive, and not as, I don't know what the word is, like rigid in their beliefs, I guess. So there are individual differences within every religious or belief group. So again, we always clarify with our clients the specific beliefs and practices that are going to provide comfort to them and are preferred by them. Other things, although many clients in the US are Protestant, Catholic, and Jewish. You will encounter others as well. You're Muslims, some people that don't have religious affiliations. Um, Again, it's all about education, right? As a future nurse, you are never going to stop learning, and that is going to include the things that are coming from our clients, right? I feel sometimes I learn new things every day when I work with clients, just because, some things they just change over time. Um, I think I love religion. I like just learning the different practices and some of the things that each of the religions or the formal religions do, are just very interesting to me. Um, so we look at some religious and I was talking about, I think I was thinking about this last term. And so, um, uh, the what is it? The Jewish population. Okay, so the Jewish population, not all, most of them will follow a kosher diet. Okay. Does anybody know anything about kosher diets?
They don't eat dairy with their meat. All of their meat has to be separated in packages or something like that.
Yeah, so yeah, it's so different. So yes, they don't eat dairy with meat. It actually has to be like separated by like 6 hours or something like that. Like, it is like super unique. There and there it can't be prepared by in the like you can't, let's say, make macaroni and cheese in one pot and then use that same pot to make something that has meat in it, right? They have like separate cooking, um, what's the word I'm looking for? Appliances or whatever, like pots and pans for those different things. It's even
It's a
separated in there.
kosher. It's a kosher meal, right? Is that close to like vegan?
No, because they will still eat meats, but they're very specific about the types of meat that they eat too.
Okay.
Like they have to have a bivalved hoof. Like it's interesting, but I was like, I would probably like if you grew up within it, it's one thing. But yeah, like fish have to have scales, like they're very specific with the type of food that they eat. Um, and with that being said, I was talking with I think it was last term we were talking about it. And we were like, what if you're in the hospital and you're Jewish and you follow a kosher diet? How is the hospital going to provide food for that client? And it's interesting because somehow along the way, something popped up I was on Facebook one day about kosher meals. And this one, she's actually a nurse and she is Jewish. And I don't remember where she was, but she was at a hospital in New York. And they actually have like a food pantry with all kosher foods in it. So the food isn't prepared there at the hospital. It's brought in from kosher restaurants or stores, so that the population and the Jewish population have kosher foods that they can eat. So I thought that was really cool. And it's like a pantry. Um, but their diet is very strict, very strict. And so, you know, again, we want to incorporate culture into the client's plan of care. Yeah. We also want to include their religion and their spiritual needs as well. Um, So yeah, I just thought it was like just really super interesting. It was, I guess Google is always listening or somebody's always listening because like I said, after I had asked that question, I had started to see stuff pop up. And I mean, again, thought it was pretty interesting that that happened. All right, so we have what? We've got about 15 minutes. Perfect. So I have some practice questions. Um, all right. I am going to, so these are going to be, what are they going to be? I think I chose, my topic I chose was communication and culture. So those are two of the topics. Um, that are going to be on this exam. So I'm going to share my screen. You can answer the question out loud, or you can put the answer in the chat, whichever you're more comfortable with. And I will just make sure that I have the chat open. Where's the chat? Oh, I do have it open. All right, so here we go. Can you guys see it, or do you need me to make it bigger? I will read it, but so we have a newly hired nurse that is experienced harsh criticism from the preceptor during orientation. Upon completing orientation, the charge nurse assigned her the most difficult and complex patients. What would the nurse do first? So one, use assertive communication to discuss the assignments with the charge nurse. Two, talk to the nurse manager about the behavior of the charge nurse and preceptor. Three, make a formal written complaint and submit it to Human Resource Department. Or four, review the facility's policy on horizontal violence like bullying and harassment. All right. So what do you think? Got one. We got two. Got another one. All right. Come on. What are we going to do? Got another two.
Two.
All right. All right. So two. All right. Good job, Dominique. All right. So I'm going to go with two. Oh, wait. Let me count. One, two, three, four. We got more. Oh, no. We got one, two. We got a tie. I need one more. One or two. I need one more to break the tie.
Two.
All right. So majority wants two. No. Now we got another one. All right. We're just going to use one. All right. So the correct answer is to use assertive communication to discuss the assignments with the charge nurse. Okay. So again, the rationale here, the first action would be to talk directly to the charge nurse about the assignment. This could be difficult, especially for a new nurse. Okay. Um, I'm sorry. But assertive communication can be carefully planned and then delivered with a calm and non-confrontive tone of voice. So the other options, though, may be considered if the nurse continues to experience harassment or bullying from the other members of the healthcare team. So remember, assertive communication was what? It is sticking up for yourself. You have a voice. If your rights are being infringed on, you have the right to talk up, to speak up, to talk up. All right. Again, assertive communication is not aggressive communication. We are just, right? We want to make sure that we are not having our rights infringed upon, right? So we're always going to start at the bottom. So discuss the assignment with the charge nurse. Then someone said follow the chain of command. Absolutely. The charge nurse is the first member of the chain of command. It's just like if you have an instructor that, maybe you disagree with something about the instructor. You always go to the instructor first, okay? And then, like I said, then if that doesn't get resolved, talking to the charge nurse, then you go to the nurse manager. Then maybe you need to review the policy and file that formal complaint, right? But you're always going to start with the person. All right. Which statement made by the nurse will give the clearest direction to the assistant personnel about assignments? Okay. So, number one, the patient needs to be walked down the hall today. Number two, place the patient in the chair for at least 1 hour today. Number three, please bathe and dress the patient by 10 a.m. for transfer. Or four, put a suture tray in the room for the surgeon. Which one of those is going to be the one that provides the clearest direction? All right. Good job. Number three. So yes, right. Please bathe and dress the patient by 10 a.m. for transfer. So It's clear, specific on what needs to be done and why it needs to be done and what time it needs to be done. Okay, good job. All right. Ooh, I don't have this one. Oh, because it's communication. I was like, how did this one come in? So the patient has a Glasgow coma scale score of 8. Which instruction would the nurse give to the assisted personnel? So one, encourage the patient to independently do as much self-care as possible. Number two, remind the patient to use the call bell whenever assistance is needed. Number three, identify yourself and explain everything you are doing as you do it. And four, raise the head of the bed before feeding the patient or giving fluids. All right. So first thing first, what does a GCS score of 8 indicate? What does that mean?
Like their response to verbal, motor, and stuff is declining.
Okay, it's okay. So a GCS score of 8 is generally what then? If it's
A
Not
brain
good.
so
injury,
okay, brain injury.
a
Okay.
brain injury.
That's
So
true. Mm.
I didn't hear you, Natasha. I'm sorry.
Oh, no.
Okay. So a GCS score of 8 is severe. Okay. So the patient at this point is either in a coma or a near comatose state. Okay. So they usually are going to be very or limited. If they're not in a coma, they're going to be very close to a coma. We'll just leave it that. So they're probably not going to respond. Remember the GCS score is a 15-point scale. Okay, so it is graded, right, up to 15 points. They can go as low as 3 and as high as 15. So 3, they're usually in a very deep coma. 15 would mean that they are completely alert. All right. So with that understanding, what is our answer?
I say 3.
3. Very good, right? Because, excuse me. Ooh, a GCS score means of 8 means that they are in a coma. So we always remember, right? Hearing is the last sense to go. So even if the patient is in a coma and they are completely unresponsive and we still are providing care for them, we always talk to them and tell them what we are doing, right? You never you never ever go up to a patient and just start doing things without saying anything. I don't know, you can call me weird if you want to, but even when I have a patient that I am providing post-mortem care to, I will talk to them, knowing that they're not going to talk back to me, but I still will talk to them and let them know that I am, what I am doing. At this point, I think it's just habit. But we always communicate. For a patient with dementia who is prone to confabulation, which instruction would be the best to give the assisted personnel?
What does
So
that word mean?
I was just gonna ask, what does confabulation mean? Has anybody heard that before? Confabulation. So confabulation is where, especially with dementia patients, because they lose that memory, they fill in gaps within their memory with, either made up stuff or, misinterpreted information, and they believe that is to be true. So it's just their way to, like, if they can't remember something, they just want to fill in the gaps. Okay, so it could be minimally true, or it could be just, something like a compensatory mechanism. So number one, don't believe anything the patient says. He'll try to trick you to get his own way. Number two, gently correct the patient if you notice errors or falsehoods in what he is saying. Three, ask the patient to give specific details related to the topic to stimulate his memory. Or four, accept what the patient is saying because it is his way of filling conversational gaps. So, all right, we got more fours than threes. So, yes. Sorry. The nurse would direct the AP to accept what the patient is saying. Again, confabulation is a form of speech that can occur in cognitive disorders. The person will make up experiences, words, or answers in order to fill in conversational gaps. The intent is not to deceive, but to compensate for a failing memory. Responses can be vague, generalized, or untrue, but correction is not necessary, and pressing the person for details may increase anxiety and defensiveness. Good job.
I would think with that question too, like it's a UAP, so certain things is above their scope.
True. But and there that's the reason for the clarification right from the nurses because you know they may start hearing things and not know if it's true or untrue and it in some cases and I'm going to tell you some of these stories that some of the confabulations that they come up with can be pretty real sounding um and it can raise some concerns. Like I had one who, I had a dementia patient once who told me that the reason why she was in the facility was because her house burned down. Okay. And she had like a whole bunch of other stuff like she was saying, and I was like, oh my gosh, this poor woman, she like her house burned down, and I was like, so like, I was like, I felt really bad for her, and then I found out that no. What ended up happening is she had a fall and was actually at another long-term care facility. Something had happened, but in the process, the family had sold her house, okay, because she couldn't live there independently anymore. And because she knew that she didn't have any, she didn't have her house anymore, and because it was sold, but she couldn't remember that it was sold, so she said it was burnt down, right? So it can sometimes you're like, oh my gosh, is that true or is it not true? And a lot of times we may not even know, really, depending on how far-fetched it is or how real it sounds. Um, all right, so now the AP is assisting a diabetic patient with his bath. Which priority instruction would the nurse be sure to provide? So one, check the patient's blood pressure before and after his bath. Two, provide the patient with a snack after his bath is completed. Three, assist the patient back to bed after his bath is completed. Or four, report any breaks in the skin seen while assisting with the bath. Four. All right, yeah, most people are saying four, so awesome. Yes, I'm gonna go with four too. So yes, breaks in the skin increase their risk for infection, right? So, and that is part of our job is to do weekly skin inspections. Anytime that we see something, it needs to be noted and treated as soon as possible, to prevent infection or even further deterioration of that wound. Um, which assistant personnel or AP requires a reminder and additional supervision related to the use of elder speak? This is a good one. So number one, APA says, Miss Smith and Mrs. Smith, this is the call bell. Please remember to call you when you need help, or please remember to call when you need help to go to the bathroom. Assisted personnel B says, Mr. S, let me know when you get up. Now, sweetie, remember to move and stand up very slowly. Number three, assisted personnel C says, Mrs. S, what would you like to do first? Wash your face, brush your teeth, or get dressed? And then assisted personnel D says, good morning, Mrs. S, Mr. S, I am assistant D. I am here to help you with your morning care. So which one of those needs a reminder?
Two.
Number two. All right. Absolutely. Although it is likely that assisted personnel is trying to show nurturing and patience, they need a reminder about how to use clear and respectful communication. Elder speak includes baby talk and exaggerated use of voice, pace, or tone. Another form of elder speak is using terms of endearment, such as honey, dear, or sweetie, that may be offensive and sound condescending. All right, and we can do one more. The nurse is feeding residents in the dining room for breakfast. Which breakfast tray should the nurse question for a resident who is Muslim? One, eggs, bacon, and orange juice. Two, oatmeal, fruit, and coffee. Three, French toast and a protein milkshake. Or four, cheese and beef pastry with tea. Cheese and, yeah, cheese. I'm like cheese and beef. All right. This is rely on y'all's expertise. So majority is one. Toot toot. And oh, had to reread. Yeah. So yes, eggs, bacon, and orange juice. So pork may not be consumed by Muslims according to the Quran. Pork is forbidden to eat as it is considered to be impure and unhealthy. All right, you guys are great. Awesome job. Any questions for me?